Well, good afternoon, everyone. Hi, so nice to see so many familiar faces in the room. Welcome. Today, it is my pleasure to introduce Professor Henrik Knutsen. He's a professor of political science at the University of Oslo in the Department of Political Science, where he leads comparative institutions and regimes research group. He's also the lead PI of ELDAR, which is an ERC consolidator project on emergence, life, and demise of authoritarian regimes. He also is a research professor at TRIO, and he's also a principal investigator for varieties of democracy project. He's very prolific. He has written extensively on questions of democratization, autocratic regimes. So without further ado, I would like to leave the floor to Professor Knutsen today. He will be presenting a really timely and important paper, which is, I think, part of the Varieties of Democracies project, which is entitled Fighting the Disease or Manipulating the Data, Democracy, State Capacity, and the COVID-19 Pandemic. Carl?
Thank you for the very kind introduction and especially for inviting me here to the seminar. So I know a lot of you at IBEI from before and see your names popping up here and there. So interacting with your research, I was very happy to be here on site for the first time and to present this paper. So the paper is co-authored with Palina Kovani, who is also at the University of Oslo. And of course, there have been written many COVID-19 articles. I mean, I swore at the beginning of the pandemic that I should not be one of those researchers writing a COVID-19 article, but some ideas are too interesting not to pursue. So here goes. So before talking about the pandemic and what used to be, well, it's no longer the most urgent crisis of the world, I guess, but the previous urgent crisis, the COVID-19 pandemic. Before talking about that and linking that up to different political regimes and also different capacities of state institutions, I just wanted to walk through the broader debate. Because I see this paper very much as linked to some very kind of well-known and arguments with a long historical kind of intellectual background in comparative politics and related fields. So there are these broader debates that have been going for decades and decades, if not longer, on the distinct benefits and drawbacks of different political regimes in terms of generating other outcomes that we might care about, such as economic development, human development, for example, reducing infant mortality, generating investments, promoting education. I mean, you see some of the same arguments that we draw on in this paper, you will actually recognize from those broader literatures. So especially this large debate on whether or not democracies, kind of with all their procedural requirements, multiple parties, discussion and debate, whether that's a good thing, basically, if you're mainly caring not so much about kind of political liberties and freedom as such, but you're mainly caring about the outcomes. So do they generate better economic policies, for example? Some arguments point to a clear no, and others point to a clear yes. And I'll go through some of these arguments more in detail and try to link it up to the paper that we're writing. Then there's a separate debate, which is partly linked on also coming out of much of this early literature on democracy versus autocracy, and many empirical studies finding no clear difference between democracies and autocracies, pointing out that, well, maybe we've been focusing all along on the wrong types of institutions. So maybe it's not about democracy. Maybe it's more about how the state is organized. Is there, for example, a well-functioning state bureaucracy where the bureaucrats are recruited according to merit, where you follow laws impartially and you don't make kind of discretionary decisions based on your personal preferences, but you basically follow the laws as a bureaucrat? Maybe that's the important thing. So maybe it's about the bureaucracy, maybe it's about state capacity, the capacity of the state to implement policies. So you can be a democracy or an autocracy, doesn't really matter, it's all about the state. So that's a different debate, I mean, and that's been kind of going on for several decades as well. But I think, for example, some of the work by Francis Fukuyama from a few years back, promoting that kind of rule of law and the state really matters rather than democracy. That's one kind of popular, widespread version of this argument. So that's the general one on which one is better. And of course, this can differ a bit according to what kind of particular outcomes and policies you're looking at. And especially, I think, when it comes to handling crisis, there are some additional elements to this. And I think, in particular, in crisis situations where there's an exogenous shock to the system, there's something that happens that politicians need to respond to. You need to implement new policies in order to mitigate a crisis. That introduces an element of speed. You need to react quickly. And crisis situations are, kind of speaking now with the situation in the Ukraine very fresh in mind, very messy in terms of the informational environment. So it's really hard to, this is a new situation, it's hard to know what's going on. You need to handle and process information, deliberate, and arrive at good conclusions. So which systems do that better? Is it autocracies or is it democracies? And I think, especially then, given the nature of the COVID-19 pandemic, at least in its early stages, I think this very much represents such a crisis situation, kind of dense informational environment, the urgent need to respond quickly. So these are the broader debates. And then our main argument relates not only to regime type as such or state capacity as such, but how these features might actually interact in influencing the outcomes of interest. And here, basically, crisis management in the COVID-19 context. Right, so here are some pictures. This is a picture, kind of upper left corner. This is Wuhan at the very beginning of the pandemic, or at least when we got to know about the pandemic, when the Chinese really put in motion a huge operation in order to build a hospital from scratch, and was able to do that in a matter of days. I think this speaks to an ability to react relatively quickly, muster resources, and to kind of quickly focus on addressing kind of policy solutions to address the crisis situation. So hospital spaces were scarce. Let's build a hospital from scratch. It's pretty marvelous that you were able to do this in a matter of days. And this is also something that reverberated around the world. Kind of, I remember seeing this, watching this video on YouTube. I don't know if any of you guys saw this YouTube clip. Basically, day by day, the new hospital being built. And I think that kind of that particular scenario or that particular video actually did quite a lot to influence the wider debate, especially when contrasted with slow responses in several democracies, on how authoritarian countries could move very quickly, fewer constraints on policymakers, in order to respond to a crisis situation. So that's kind of, now I'm already starting to introduce at least one side of the authoritarian argument. And as you will see, there are some very strong counter-arguments pointing in the other direction. So for the counter-arguments, you could start with Lukashenko. He's relevant also today for different reasons. But with the COVID-19 pandemic, he was then had this infamous quote on vodka possibly being a good good way to make sure that you stayed immune from COVID-19. So this speaks to kind of the informational issue in a sense. It's really hard to know exactly what are the good ways to mitigate the spread and the consequences of this very new disease. But it also speaks to, I think, even if there was a US president also arguing that you could drink bleach instead of vodka, but that was kind of quickly taken down in public debates. It also speaks to the notion that if authoritarian leaders are not willing to take such a crisis seriously, or are not willing to expend resources on addressing a problem, they have quite a lot of leeway in kind of running their country to the ground, basically. So if power is concentrated with the president, and the president basically says, well, you can drink vodka, this is nothing to worry about, that bodes ill for the country in question. That would be hard for different reasons to envision such a development in a democracy. Lower right corner, by the way, here you can see, and this is also speaking to something that we're dealing with in this paper. So one thing is the actual consequences of the pandemic. So how many people are becoming seriously ill, how many die. Another thing is exactly how many are reported to have died. So how are different political systems accurately monitoring, tracking, and reporting deaths? So basically consequences of the pandemic. And are they doing so intentionally or unintentionally in ways that misrepresent the actual numbers? So this is a very small picture, but you can see here, and I'll get back to this particular graph. Down at the bottom here, these are the officially reported COVID-19 deaths from Belarus. These are what we say are the best estimates. Kind of the upper dotted lines are the best estimates of the number of COVID-19 deaths in Belarus, relying on so-called excess death data. And there's a huge discrepancy. We can get back to the data later. There's a huge discrepancy between what is reported officially as COVID-19 deaths and what the best estimates of the actual number of deaths is. So this speaks to both perhaps an ability to track and report information on this outcome, but also probably the willingness to admit that the pandemic is really taking a large toll in the country, and the ability of authoritarian leaders to cover up information that is not to their benefit. You can also see that there's a gap in this time series. So this is extremely interesting. So many authoritarian regimes, rather than reporting false data, don't report data at all. So when the Belarusians learned that people were estimating the actual number of deaths by using excess death estimates, they stopped reporting total death estimates to kind of avoid this line being produced. So there were some hackers in Belarus who were able to hack in and get the death numbers, and then later on it's been estimated. It's an anecdote. Last picture. So now I'm basically trying to bring you back to the early days of the pandemic. This is a point about this is from Milan, basically spraying the streets with disinfectant. Today we're all sitting here with masks, right? This says something about the very difficult nature of knowing exactly how best to respond to a crisis such as the COVID-19 pandemic. At the beginning, everyone was afraid that it was transmitting through surfaces, touching surfaces, etc. And then it turned out this was not the case. It was more air transmission. So today you see more masks and fewer kind of full-on disinfections of street spaces. Speaks to something about the difficult information environment. All right. So let me be a bit more focused and try to take you through the main points of the paper rather than trying to motivate and bring back pictures from the early days. So what we do in this paper, Paulina and I, is that we consider how both regime types, so democracy versus autocracy, if you like, we're using mainly graded measures of democracy, thinking about it on the scale, but basically the degree of democracy, whether or not that influences, number one, actual deaths from the COVID-19 pandemic, and number two, the reporting of such deaths. So basically, are deaths being reported accurately, or are they underreported? Is the regime more or less giving us the right or wrong statistics? We consider state capacity as well, discussing how that should influence the same two outcomes. So there are two main independent variables and two main dependent variables. And basically looking then at the interaction between regime type and state capacity. Yeah, that's the core of the paper. So the argument is that political leaders differ both in terms of their will, and will in quotation marks, so the incentives they have to expend costs to actually use their time and resources to mitigate negative outcomes from a crisis such as the COVID-19 pandemic? So are you actually willing to stop spending on Mercedeses or kind of highways to your main palace and rather spend on healthcare and basically mitigate consequences from the pandemic? And do you have the capacities to do so? So even if you really want to save the lives of people and kind of reduce this spread of the pandemic, are you able to do so? Do you have the ability, for example, to collect information, change healthcare policies, muster the resources to fight? And our argument is that you need both. This is a very simple, straightforward argument. But you need to have both the political incentives to select policies that mitigate bad outcomes, but then you also need to have the capacity to identify and implement these policies. And the same thing is true for the truthful reporting of these outcomes. So if I'm a leader, I have a large statistical central agency with really competent people, but I'm in full political control, and I know that if word gets out of how bad the pandemic is across the country, that could have political implications for me, then I might have the capacity to report truthfully, but I certainly don't have the incentives to do so. So I could have the incentives to basically cover up and say there are no COVID deaths, or there are only a few COVID deaths in the country. Again, you need both in order to get accurate reporting. The main empirical findings, just jump to that. If you look at the official statistics and run our regression model, so if we believe Lukashenko when he says there are very few deaths, or if we believe the president of Turkmenistan, who a few months ago at least said, well, there have been no deaths in Turkmenistan from COVID-19 whatsoever. I don't think, no cases actually. Well, if you do that and control for the covariates that we use, you will get the result indicating that democracy is really bad in the sense that it's correlated with a higher number of COVID-19 deaths. This, we argue, is only a mirage from official statistics. So when we use our alternative measure, which we argue is a much better measure of actual deaths, there is basically no average relationship between democracy and COVID deaths. This is then due to autocracies misreporting or underreporting the number of deaths from COVID-19. So there's a very strong relationship between degree of democracy and how truthfully you report COVID-19 deaths. State capacity seems to mitigate both deaths and misreporting, able to fight the pandemic and also able to report more accurately. But again, perhaps clearest and most robust pattern is the interactive one. So in those regimes that combine both a high level of democracy and a high level of state capacity, we find fewer COVID deaths and fewer and less underreporting, everything else equal. I should note, and especially now that I'm presenting with a mask, so I'm probably presenting worse than I'm usually. I'm not on my A game. I've had a short vacation in Spain right before. So I'm in vacation mode. I have a mask on. So I would be happy to take questions from you guys to kind of liven me up. And so if there is are any questions, feel free to ask. Yeah.
Just a clarifying question. So when you say political leaders, do you mean leaders or not?
Yeah. So that really is a good question. I think the way we're thinking about it here, the way we're theorizing it is basically the key decision maker. So it's not a clear entity in the sense that in a personalist autocracy, it might actually be one person who is the main kind of the main theoretical unit of interest, whereas in a junta it would be kind of a collective. So in this paper, we're not theorizing kind of the decision maker as such, other than pointing to how say leaders and say, let's say a prime minister in a democracy would take into account electoral consequences, or for example how the opposition would react if there were a lot of COVID deaths. So basically you could think about this as a prime minister or president with the extended circle of, or with his or her circle of allies. But we're not being more precise than that in this paper. Yep.
There's quite a bit of relevance in there the will of the leadership and the capacity to deliver on mitigation, crisis mitigation. Would you say that will is generally will to report properly is generally associated with democratic regimes, or could it also be associated with autocratic regimes?
So yeah, this is at least my interpretation of these data. So or these patterns, and more generally building on the existing literature on both kind of the different statistics. So for example, the studies on GDP reporting and how that's much more inaccurate in autocracies than in democracies. I tend to view that as kind of it's an extended political will argument, in the sense that if I'm in a political democratic environment, it's really hard actually also to misreport. So it's a good question, because in the sense that will here is, I could try to kind of cook the books in a democracy. There have been democracies that have done this for GDP numbers and taxes before. Greece's financial crisis is one example, but it would be very risky to do so. I mean, to try to intervene and do it. So here I'm thinking in terms of the incentives for an autocrat is very different, in the sense that you could do it and get away with it. But I agree. I mean, in a sense, it's also a capacity argument. It would be hard to do it without being caught. That would be the. But if I take into account the fact that being caught is a strong disincentive, then I think I could use will. Yeah.
Maybe you get to that. I was wondering, how do you empirically establish these?
Yes.
You have the official numbers of debt, and then you have an estimate.
Yeah.
I was still wondering whether there are two things going on. Yeah. So if there's a huge gap in the numbers, either whatever statistics office, yeah, shambles, whatever the program is called, the poker, and doing the job, or there's deliberate strategy. We have the numbers, we don't want anybody to know.
Yep.
So how do you disentangle the
Right. So basically, the measure that we construct take these official numbers and look at the difference between the official number and the excess death measure. So it uses the number of deaths relative to the prior historical period, and then corrected, for example, if there were other things that are going on, natural disasters or so. So you're basically making the assumption that if a lot more people die than in the previous years, correcting for demographic trends and all things, that's due to the COVID-19 pandemic. So that's basically the measure. And of course, for any single country, there might be a lot of things going on there. And I wouldn't say this is just a proxy. It's very much a proxy of misreporting, and very much a proxy of actual deaths, to use excess deaths. But in the larger scheme of things, looking across countries, I would say that it's actually due to how poorly constructed and how incomparable and kind of low, how little trustworthy these official statistics are. I think it's a fairly decent proxy. Whether we know if it's because kind of intentional misreporting or just a really poor statistical office, that's hard to disentangle, and we can't really nail that empirically. So when I'm presenting it as kind of, well, look here, autocracies are basically misreporting a lot more than democracies. It could be due to political kind of the will. This is intentional misreporting. That's also a theory, the kind of the theory informing the inference, in a sense. I can't really pin down that this is due to will, and sometimes it's a mashup, right? Because if you're working at the statistical office and you know that's kind of your leader is going to be extremely unhappy if you present him or her with these really bad COVID numbers, you might actually start cooking the books yourself. So it's so the exact mechanism, kind of the intentions here, doesn't come from the data. That's theoretically driven. But we think that the most plausible interpretation is that the regime difference is due to more will, so to speak, intentional misreporting, the fact that you have systematic differences in underreporting for democracies and autocracies at the same GDP level, same state capacity level, etc. We think that's the most plausible argument. For state capacity, we think of it more as an inability to gather and monitor and collect information. But yeah, those are theoretically informed inferences. Yeah. Okay. I think you're first. Yes, so now you're thinking COVID-19. So now you're thinking COVID-19 deaths, right?
Yes.
Yeah. Yes, so this is actually one additional reason, in addition to this manipulation thing, which I focus on with Lukashenko. I think it's a really bad idea to use official COVID-19 death statistics as a proxy for COVID-19 deaths. So even for countries who kind of willingly want to report kind of the true kind of scope of the pandemic and report deaths truthfully, definitions differ quite a lot. It's really hard to compare across countries, and this is where the excess death measures, which is basically looking at mortality rates, so dying from any, no matter what the reason, you just count the deaths. So there could be differences there as well, but it's kind of far less reliant on particular definitions. So if you're dead, you're dead, basically. Yeah. Oh, yeah. Yeah, because there's the lag in the reporting. Yeah, is that what we're?
But yeah, so I was wondering how. Okay,
Yeah. No, but I mean, there might still be issues with comparing excess deaths as well. What we do in the paper, so that what we know is that there's a lag in reporting of deaths. So this is one reason why we cut the time series in September 2021 instead of kind of going all the way up, because what we see is that this large database we draw from the Economist, the new Economist database, which also estimates mortality rates and excess deaths based on kind of when data is lacking. You see more estimates, but then you see kind of deaths being updated as you go along. So I can't guarantee for kind of the accuracy of these mortality rates, but the belief is that they are at least more comparable than the COVID-19 deaths, which are relying on a whole extra set of assumptions, basically. Yeah. But we might be. So we already have a quite extensive discussion on on the measure, but we might have to go kind of even more into details on the validity and reliability aspects, even of the measures that we use, because of this is not easy to compare across countries. Yeah.
Yeah, the question that maybe you'll come to that. I was wondering how all of this interacts with general context and also so I guess this would like both systems, democracy, capacity, reporting, and but I assume you will also that.
We will. So I'll get back to that. I can answer quickly right now. I mean, we run different regression models. So in a sense, kind of the number of doctors per 1,000 inhabitants, for example, obviously important for doing something about or kind of healthcare spending, for example, important for mitigating the number of deaths, given that you have a number of what's the English word again? People that have caught the disease, basically. So these are important correlates obviously, and with a real causal impact. We're not doing that in all the regressions, and one reason why we're not doing so is that there is very good reason to think that democracy influences health spending, number of doctors per capita. So there's a lot of literature both on state capacity, quality of government related concepts, and regime type being important for spending priorities and the functioning of healthcare systems. So in a sense, if we control for that, we're kind of blocking one main pathway that we think is theoretically relevant to include. So if democracies are better at mitigating COVID deaths because they invest more in their healthcare system from before, then that's actually something that we want to capture in our estimate. So what we do then is to basically show models both with and without these covariates, or a set of healthcare related outcomes, and the results are mostly robust. They're actually quite robust to that. I'll get back to it, at least in the main specifications. That doesn't really alter the findings. All right. So let me see how. When did I start? That's the 30 minutes ago. Yeah, so I should probably speed through the theoretical argument and then present you with the data. And so I've been on holiday. I've been drinking red wine. And, right. So I think in terms of the state capacity argument, just wanted to highlight this point. If you look at the literature also on state capacity, this ability to obtain and aggregate information. And also, I think what is relevant here for a crisis such as COVID-19, which hits kind of broadly, that you're able to track deaths and what's going on even in rural areas in the periphery of the country, that's really key. So I think the argument for why state capacity matters both for kind of the effectiveness of the policy response in mitigating the consequences of the pandemic is pretty strong, but also in terms of this reporting issue. It's not straightforward to find out in a large country with weak state institutions exactly who is dying from COVID and who are not, especially if people are not being tested, right? So you don't have the capacity to test. They're maybe not even going to the hospital. So this is not a straightforward task. But I think I've gone through the argument in brief, so I'll speed up and just finalize this theory part once again by saying that, well, the arguments, if you look at the arguments on democracy, is it good or bad for mitigating the COVID pandemic? If you look at the arguments pointing to democracy being a bad regime for facing this type of crisis, they're basically capacity-related arguments. So they're related to, for example, you're not able as a democratic leader to respond very quickly because there are constraints, there are procedural rules that you need to, there are loops that you need to jump through in order to come up with a policy response. And basically, even if you wanted to implement a strong policy response, there are these very annoying civil liberties that you need to take into account, right? So you can't basically wall off people inside their own homes. You have to take into account the Constitution, so you can't have the same policy response, just to put it on the kind of very crudely. So those are basically related to limits to what democratic leaders can do. Whereas if you look at the arguments on why democracy should be good, it's basically related either to electoral incentives. For example, if I'm a purely self-interested democratic leader, I might not care if people at the other side of the country are dying from COVID-19. I might want to spend on something else. If I'm a truly self-interested, cynical leader. And those might exist, right? But on the other hand, these people on the other side of the country are still going to vote in the next election. So even if I'm super cynical, I will have to care for them in order to preserve my own survival. So it's a standard kind of rational choice, self-interested explanation of cynical, self-interested politicians. So that's one argument, and that points to will in the sense that I'm incentivized and forced to care about this mitigating the consequences of the pandemic due to my own political career. The other point is related to, yeah, so now I'm starting to go into the theoretical argument, but it's related to information flow and discussions with decision parties. But basically this, some of these arguments point to autocracies having the potential to be better to mitigate the consequences of the pandemic because they have a capacity to react swiftly and with force. And our argument is that, well, if you need both the will and the capacity, in a sense, if you have a high state capacity, you might actually be able to compensate for some of those capacity advantages of an autocracy. So if I have a very efficient bureaucracy who can implement healthcare policies very effectively, well, I might be able to spend another week in Parliament before passing this measure. But then, kind of on the implementation side, things will go swiftly and the intended policy will be implemented much better. So in a sense, you're compensating for the lacking capacity due to democratic constraints by a higher state capacity. On the will side, I mean, you can have all the capacity you want. You might have the best bureaucracy in the world, and you have the possibility to introduce measures to mitigate the pandemic. If you don't want to politically, if you want to spend the resources on other things, then that capacity doesn't really matter. Right? So in the sense that these are complementary aspects. So if I sincerely believe that this pandemic is nothing to worry about, you can kind of continue to ride your tractors and drink vodka, then state capacity doesn't really matter. So in that sense, this combination of democracy and state capacity is what we anticipate should give relatively few COVID deaths. Yeah, so we've gone through this before, so I'll try to be quick. There are several issues of misreporting of COVID-19 deaths, and we present a couple of case examples in the paper. But this is kind of, I've been reading news stories about this for a couple of years now, right? Almost 2 years. And there are so many cases that you could draw from that are kind of, this is blatant misreporting. So we're presenting Belarus and Tanzania in the paper, for example, obvious cases of misreporting of COVID-19 deaths. So there are good indicative evidence from different cases suggesting that this might be ongoing. And there's also this issue of comparability of official COVID deaths. So, for example, if your national definition requires that you have a COVID test or even an autopsy and proven COVID in order to be registered as a COVID-19 death, then you will have far fewer COVID-19 deaths than if you have a definition that says, well, if you had COVID-19 symptoms and you were in contact with someone who had COVID-19 and then you died, you're registered as a COVID-19 death. So Peru is an example of a case who went from the first type of definition to the second one, and then you see a large jump in the data. So there is kind of both across time, but especially across countries, comparing these officially registered COVID-19 deaths that you will typically see in different newspapers, for example. That's a hazardous enterprise. So we have no illusions about excess death being a perfect alternative, but we think it's a much better alternative. So basically estimating, saying that, well, if controlling or adjusting for demographic factors and other crises, a lot more people died in 2020 than what was the case in 2018, 17, 16, average of those, then you can attribute, broadly speaking, those extra deaths to COVID-19. So that's, in a nutshell, the excess death measure. Our reliability and validity issues also with this, but we think it's a much better proxy. So we use the Economist's data, and this is kind of available online. It's very recent. It's very fine-grained temporally. So you have, you can download for any given date. You can download, for example, the excess deaths. And what I also think is really important here is that since kind of reporting deaths It's not done for all countries. They use, in order to get the full sample, they use a machine learning algorithm to produce estimates where this is missing. So that might also, yeah. So it's even more fine-grained. So you can get it with pretty fine-grained intervals. So there you might have some of the issues that I think you alluded to with kind of if there's something about the reporting of that for a country, for like if you report with a 3-month lag, then or there are updates, then there might be issues. So this is why it's much more fine-grained. But we then stopped the time series in September to get kind of the adjusted data going back from when we last did the regressions. But yeah, we do it. We use the accumulated version in our regressions. We do a cross-country regression. So we take this very fine-grained data, but we then aggregate it from basically from the start of the pandemic until September 2021. But we think the increased coverage is really important because there's a systematic relationship. If you look at some of the COVID papers that's out there, you typically have 60 or 70 countries, and these are not randomly selected countries. So even if this introduces some issues that we discussed in the paper, for example, the fact, and so this is something that we also can discuss in the Q&A, the fact that they are using measures of, for example, from VDEM in this machine learning algorithm to predict deaths. So that introduces kind of some tricky relationship between our variables. But even more so, or despite this, I think this sample selection issue, the fact that you're throwing out countries with typically weak state capacity and high death rates, I think that's a much bigger issue if we want to generalize from these estimates. Okay. So here are just a couple of examples. So we've already been through the Belarus one. Here is Tanzania, where the previous president, declared there was no COVID, and then he died from a heart attack. Rumors have it that was COVID related, and there have been. It's we could have written a paper only with anecdotes. I think that would have been possible. Okay, for democracy, we basically, our theoretical arguments point to the importance of elections, electoral incentives, but also free speech and free debate information flows. So this is one reason why we think using the polyarchy measure from VDEM kind of taps into the theoretical mechanisms that we're interested in, and it doesn't overlap with our measures of state capacity. This is a 0 to 1 index, basically taking into account competition, participation, freedom of expression, freedom of association. This is tricky. State capacity is kind of one of the concepts I've been thinking about for years, and I know many colleagues say the same. Still not sure exactly what it is. I think it's hard to wrap my head around it. It's a very tricky concept. There are many dimensions to it. You could divide it up by policy area. You could divide it up by like functional tasks. But I think at least there are some really good definitions right here where we're not so much using the core definition, but we're looking into what we think is a core condition for having high state capacity. Even if it's defined as the ability to implement policies as they were intended by legislators, even under difficult circumstances across the entire territory, that could be one definition. What you need in order to do that, or to realize high state capacity according to other definitions, is a bureaucracy of high quality. And high quality also fairly imprecise, thinking of a Weberian bureaucracy, which basically functions so you have relatively skilled bureaucrats who follow rules. So they're not following their own personal whims, they're well trained, they have clearly delineated areas of responsibility, and they follow rules and rule work. This, we think, is a core condition to realize state capacity, no matter what the definition is. So this is why we use a measure from VDEM impartial and rule-following administration. We use that as a proxy. Now there is a measure that you might say captures state capacity more directly, or at least it's called the state capacity index from Hansen and Sigman. This is a really nice, really advise you to have a look at their paper and how they're using. They're estimating a latent state capacity measure from using very many indicators of state capacity. So it's kind of broader in the sense that it's using different indicators and then trying to capture the underlying dimension. One issue with this is that we have to measure it then in 2015 rather than 2019. That's not a huge problem. I think the fact that we're losing 10 countries was kind of the main reason for why we then opted for the VIDA measure instead of the Hansen and Sigman one. But we had long discussions on exactly which one to choose. So we ended up reporting both in tables in the paper. So we're using both. So these are two very different measures of state capacity. These are not that pretty when they're kind of too hard to see, but basically on the y-axis on the left here, you have officially reported COVID-19 deaths. And along the x-axis, you have polyarchy scores. So if you are to believe these official estimates, there are relatively few COVID deaths across the time period that we're measuring, basically from, let's say, early 2020, basically for any other country than China, to September 2021. Relatively few COVID deaths among the autocracies. Positive correlation, more deaths in autocracies. So these are the official stats. These are excess deaths. So if anything, a negative correlation. And you can also notice that for most countries, if this is a measure, if we take this as a proxy of COVID deaths, there are far more COVID deaths than officially reported. Yes, that's the other takeaway, especially in autocracies. If not, people were dying for some reason in 2020 from other things than COVID that we don't have any clear idea. I mean, there could be alternative explanations, but in general, we take this as an indication that COVID deaths are underreported. And we are, of course, not the first to do this. This is something that's been discussed in the literature and used in different other studies as well. So what we then do, given these kind of economist data with this great coverage, we're able to include up to 175 countries. We're doing purely cross-sectional OLS regressions. We have 3 outcomes: officially reported COVID deaths, excess deaths as our proxy for how many actually died from COVID-19, and then we're doing excess deaths minus official deaths as a proxy for underreporting. And in the regression table I'm going to show you on the next slide, we actually flipped. We wrote it the other way around, but basically it's excess deaths minus official deaths. We take that as a measure of underreporting. Okay. So we measure democracy and state capacity, our proxies for state capacity in 2019. So basically before the pandemic, right before the pandemic. And the controls are measured before 2019. So this is often a data availability thing, 2014, but also it's a good thing to measure the control before, I think. We run 3 specifications. So we have one without control, so just state capacity and democracy. One benchmark specification where we control for income level, population density, so are people living closely together or not, life expectancy, and the share of population over 65 years due to and the relevance of age. And then we have this more extensive measure where we have all these benchmark controls, but where we also put in doctors per capita, hospitals per capita, and respiratory disease prevalence, which we think is really also endogenous to democracy and state capacity, which is why we don't have them in the main specification. So this is just for me to remember the results, right? So you shouldn't try to interpret the stars. I'll walk you through it. This is why you should have coefficient plots, but here there are many, many results. I mean, basically, long story short, if you look at the officially reported deaths, democracy, the polyarchy at the top here, comes out as positive and highly significant, no matter what you control for, indicating more COVID deaths in democracies. If you look at excess deaths, there's no relationship. There's basically no relationship. And this is a very strong one, so basically it follows from the two others. Our measure of underreporting, so the difference between excess deaths and official deaths, is strongly and negatively related to democracy. So the more democratic you are, the less underreporting you have. So less underreporting makes it a bit difficult, but you're cheating less with the numbers, basically. For state capacity, it's actually negative for this particular measure. So this is the VDEM measure of impartial and rule-following administration. We find a negative relationship both with official excess deaths and underreporting. So I mean, the negative relationship is much stronger with excess deaths. So if we are to look at official deaths, we would basically not take into account exactly how strong the relationship is between democracy, state capacity and COVID deaths. Okay, so those are the patterns of and also less underreporting in state capacity, in high capacity states. And these results are not entirely robust, I mean, but they're fairly robust, I would say, at least most of these results. So especially the results on underreporting are quite robust. So those are the more robust ones. But we try out different measures of democracy and state capacity. So the Hansen and Sigman measure gives a bit more mixed, depending on the model specification, results for state capacity than if we use the VDEM measure. We try adding different controls, civil wars, for example. Try measuring the dependent variables differently, so log transforming them. We use different cutoff dates for the COVID measures. There are some tricky discussions here on exactly when should we stop our time series earlier. It's a different disease now than what it was back then, so maybe stop it pre-Omicron or pre-vaccines even. But it turns out that it's fairly robust to different cutoff dates. We try using alternative excess death data, excluding observations with negative excess deaths. So because that's theoretically hard to wrap your head around until you start thinking about, well, when people are staying home during the COVID pandemic and not out drinking on a Saturday evening, maybe that's not an issue here in Spain, but if you go to Britain or to Scandinavia, you will see that, you will understand why this is reducing the death rates. Excluding highly influential and downweighing influential observations also doesn't really matter. Okay, so now I'm basically not going to show you the ton of graphs that look very similarly that we have in the appendix. I mean, there are interactive patterns that look about approximately like this. So what we do find is that both when it comes to the democracy, the estimated coefficient for democracy indicates far fewer deaths and less underreporting for high capacity regimes, and that's pretty consistent across specifications, or that's very consistent across specifications. So again, if you want to interpret this causally, so if there's a benefit to having a democratic system, those benefits are much stronger when state capacity is high. So if you're incentivized to mitigate COVID deaths by pursuing kind of proper healthcare policies, that only seems to bring really strong benefits when you also have a bureaucracy in place that can actually implement these policies. That would be one way to put it. The incentive to report accurately or kind of the fact that you're willing to report the accurate statistics might not matter much if you have a really poor you don't have the apparatus for measuring COVID deaths, even if you wanted to try. And the same thing then for state capacity. So high capacity is good for reducing deaths, reducing underreporting, if we interpret this closely, but much more so when you have a democratic regime in place. And that is actually my last slide. So I didn't write the summary slide. That was good because I think I'm out of time.
Yeah, I'll particularly think about the logical I can tell us in terms of the incentive versus the constraint of having to run the report, right? So we kind of construct a 2-by-2 table, like we have democracy, non-democracy, autocracy, and then we have low high capacity. We are oversimplifying between the two categories. And I would be intrigued in the cell concerning low capacity autocracies, right? In this case, you are underreporting because you have low capacity, but at the same time, is it the case for you have a stronger incentive for underreporting for some reason? In trying to appear as more capable than you are for some reason? Or is it the opposite? Like when you have autocracy and high capacity, you have the capacity to report through data, to patterns is there, but at the same time, it's there that the incentive is stronger for some reason to underreport, because that's how you can actually know that you have a lot of debt, even more than you know, because you have potentially the full information, and that's what you write. So in the sense of low capacity autocracy, we don't know whether you're underreporting because there is nothing else that you can do, or you are underreporting because it's that particular environment that may be, for some reason, for some mechanism, that due to potential decom, that's where you have stronger incentive to actually do so. Okay. Which actually the comparability between maybe there are fewer cases in there, of course, in the sample of low capacity and democracy would actually create kind of an interesting value here, right? You're underreporting, but then you're underreporting knowingly that you're underreporting, right? Because you have not true capacity to get the whole information there, and that's the best thing you can do. So it's that you're compensating to some extent to say, well, this is information that I have, but it's not really relevant, or it's not the true information that we probably have. So I think that this combination can therefore give different, potentially different mechanisms for understanding where are actually the incentives for this representative group for the reporting the data or stronger. And then what kind of potentially is the relevant audience for doing that reporting, right? Mm-hmm. So is this the international audience that we're trying to pull to some extent, or is it the domestic audience trying to signal some credibility or some strength of the regime at the same time by either underreporting, right? So people will not complain about people dying, that we say the things that are under control, or the opposite. So I think that the audience here may provide as well as theoretical elements that might be suggesting to the consideration. Mm.
That's super interesting. So one thought I had, I hadn't thought this clearly through, but I think the way I'm thinking about it is more as a kind of in the counterfactual scenario, where you actually to some extent it's not as much about reporting or misreporting the data that you have on your desk. It's more about reporting or misreporting what you believe is true. So in the hypothetical scenario where you actually had known the truth, then you would also have strong incentives in these low capacity regimes to misreport the truth. I think actually that's the way I've been thinking about this theoretically, but I haven't spelled it out. But basically, if I were to, for some magical reason, God came down and gave me these numbers, I would still have incentives to misreport in this low capacity regime. I think that's actually the way it's set up, but that's not clear from the language. So thanks, I've even written down the 2-by-2 table. So I'll have a look at that. Thanks. Thanks, Matthias. It's very good to have questions that I actually have a very clear answer to, because we were thinking the same as you. So, for one thing, for the actual deaths measure, I mean, information capacity also should matter. I mean, being able to assess the situation on the ground. But then there are also other aspects of capacity where we think a more generic bureaucracy measure would be take into account more of the relevant aspects, for example, in implementing healthcare policies. But for this particular measure, so the underreporting one, fully agree, that would be the theoretically more focused measure. So we did initially want to use that. It turns out, and I should probably just contact Jan Theorell or any of the other people at Thomas or other people at Lund and ask if they have updated it, because the version that I had access to only gave me a sample of like 78 or something countries. So those were actually collected initially for the historical VDEM sample. So I'm very familiar with the with the measure, and it's also in kind of the indicators that are in the VDEM dataset, but only for a handful of countries actually. So that was the main reason. So we did run the correlations, and the results are much weaker. But that when then redoing that analysis on the these measures for the same sample, those results are also weak. So it's a sample issue. So the sample attrition is more than 50%. But I should probably check in with Jan Theorell and ask if there are consider updates. Yeah, but I've noted down Melissa Lee's. I mean, if there are 90 countries, then maybe we're starting to get into the territory where we could perhaps use it, but still it would mean like half the sample. So it's only a pragmatic reason. We should probably write that explicitly in the paper. Yeah. Yeah. We just took it out. We had a paragraph on it. So could you repeat the last point again? Sorry? Could you repeat the last point? No, just it might overlap democracies on the paper, please, but it might not be. I'm thinking of some of the past quite good views. Yeah. Yeah. And so it might be an interesting to look at. Yeah. Yeah. Sorry, I thought I missed a specific reference or something to look at. Oh, that's a very good point, and that's a different. So I think theoretically, also especially in crisis situations, I think this kind of this whole notion of evaluating and assessing arguments openly is important, and that's partly in there. But the fact that kind of when you diffuse decision making, and you have a mix of people who kind of hit right policy decisions and miss, and then you have learning afterwards. That's not really part of our story now, but I definitely think that's a relevant one. I'm not sure whether we should kind of try to incorporate that in the broader story, or if there are any potential controls, for example, related to, it would be something crude like federalism or something, maybe to look at to block that out. But it's definitely something to think more about. I do think it's very relevant, especially in a situation such as this, where there's so much updating also across borders, right? So you see what the neighboring country is doing and succeeding or failing with, and then you update.
Yeah, well, I think we need to go back to the data that you mentioned before, but it's just funny. When you were researching this and you were looking at the excess deaths in the economy, I wonder if there's no way that you can handle the excess deaths associated as a result of a COVID-19 infection from those that are a result of other infections, other diseases, and the inability of people to access the healthcare system because of COVID. I know you don't research that. I wonder if in the literature, is there somehow a way or somebody attempts to handle these things? Because it kind of relates to state capacity as well. Many people die from cancer, heart attack.
Yep. Yep. No, I think the cop-out answer would be that it's difficult in a cross-country setting, at least, to do this properly for some of the same reasons that it's hard to measure COVID-19 official deaths properly across countries. I think you could probably come a long way kind of by some careful country studies, and for all I know, they might be done. I know that there have been kind of estimates, for example, on traffic deaths as follow kind of as a consequence of the COVID-19. So there have been studies looking at these various indirect effects, which are also included, right? So in a sense, what we are capturing is both kind of direct effects, but also indirect effects, positive and negative. So fewer people dying from accidents on a Saturday night or driving cars, but more people dying from heart attacks or cancer because they can't get treatment. So in a sense, you could say that, well, it would certainly be interesting to distinguish those deaths from the other ones, but they're also, in a certain extent, a consequence of the handling of the COVID-19 pandemic. So the fact that people are dying from cancer because hospitals are filled up with COVID-19 patients and I don't have more capacity, it's kind of partly a consequence that we're interested also in capturing. Although I would have loved to be able to do both with and without. So I think what we could do is, so we have a discussion on this and the kind of the indirect deaths and the fact that we're capturing those, and we think that there is theoretical rationale for including those as well. And I sincerely mean that. I think of that as kind of, they're secondary in a sense, but they're also related to the handling of the COVID-19 pandemic. If there were for some countries kind of individual, let's say a large influenza pandemic were to strike, and that's unrelated to the COVID-19 pandemic, and it strikes for some countries but not others, then we would have an issue. Or I know that there has been work on how to try to purge kind of natural disasters and other things from the excess deaths measure. I can't kind of vouch for how well that's done in the economist measure. That's certainly something we could dig more into. But again, I think it's these kinds of things, because there might be things ongoing in one particular country that really messes up the results, and you shouldn't trust the results of that country. I think we're then kind of resting on this, there being more countries, so basically as a signal in the noise. So I can't give you one good answer to it. I can give kind of three partial answers that partly addresses it, but yeah.
Probably the
Haven't really. So we're not discussing the possibility that you have over-reporting. I know that's, I mean, at least not in an intentional manner. I know there's been discussions in Sweden, for example, in terms of how they register deaths from COVID, kind of having a very lenient definition that they might be over-reporting. I don't think it's as common, and I don't think it's related to necessarily the same political incentives. But that might be because I haven't thought it through. So I haven't really kind of thought of any good. Yeah. So, yeah. Yeah. That's a. Well, I haven't thought of this at all, but it's a really good point. I mean, because the reporting, of course, this might not be going on at the political level, but it might be the hospitals who get paid more for every COVID. I mean, there's something in the funding procedure. This is definitely. Huh. Thanks. This is great. Or not great in the normative sense, but for the paper sense, I mean, I think, yeah, so this is kind of once you start thinking of these principal agent models, when you hear it, it's so obvious, but I didn't think of it. But yeah, but I think it's still worth noting. I mean, if nothing else, it's at least a footnote. It's probably more, right? Because I think in general, if you have those kinds of things, especially in where you have particular funding systems and where you have kind of hierarchical organizations with different reporting up the ladder, again, it might be an argument for using more of an excess death measure in any case. I mean, even if it's over-reporting or under-reporting, excess deaths should be, I mean, as long as you're not then misreporting deaths as such, but that might also be the case. But yeah. Yep. So the small sample first, that's related to the number of countries and this being a cross-section. So in that sense, it's hard to do much about it, except kind of moving to, if we were to move to some kind of panel set, which I think in this case would be, I love panel data, but but not in this case. I mean, it could. I mean, as always, with limited observations, there is uncertainty, and so this is why we're looking at kind of outliers and extreme observations. And also, as you can see, there is uncertainty here, which is, of course, also taking into account the numbers. But these patterns are pretty clear and strong. So, I mean, the statistical significance, in a sense, and that should take into account the numbers. But there are other issues, and I think the confounding question, there we might actually do even more thinking if there are other covariates that we should control for. I mean, that's always the possibility, right, that there is some underlying variable. I'm not sure. Usually in a panel setup, you would kind of resolve this pretty easily by kind of including the country fixed effects and the year fixed effects. Kind of you deal with a lot of confounders in that regard. Here we don't have these opportunities, so we do a lot of kind of additional robustness tests, controlling for things that we thought might be influencing it. We did not look at like the shocks, particular crisis shocks, for example, strength of those. And there might be yet other covariates also that we should look at here. I think one issue in general with these independent variables is that we are well aware that they're not exogenous, but at the same time, so democracy, take for example democracy and economic development, there are very good reasons to believe that they both kind of mutually influence each other. And this is the case also, for example, for the medical system, all kinds of policies, the ability to kind of mitigate the severity of a crisis is also not exogenous to regime type, right? So the severity of the financial crisis. So the more variables you put in a sense, you solve the confounding problem, but then you quickly end up in a post-treatment problem. So that's also one thing that we're grappling with, and our solution now has been to be a bit sparse in terms of the controls and try out different models. But I'm sure that we could be more convincing, or at least try out and see if there are any kind of killer covariate that could do away with it. I would be surprised if that was the case, given the pattern of the results. We could maybe even try some sensitivity analysis just to show how strong the confounding would need to be to alter the results. Maybe that's what we should do in this case. Yeah. Thanks. And those are really good suggestions. We didn't disaggregate the democracy variable now. So the one we're using, the electoral democracy one, is mainly related to freeness and fairness of elections, but there's also kind of freedom of speech, because that also feeds into the freeness and fairness of elections. But we haven't tried to disentangle the democracy side. I think the civil society, that's really plausible. that the nature of civil society could actually be important here. So this is something we could actually assess by using kind of more fine-grained VDEM indices, for example, and check if there are any kind of more inductively, basically. Yeah, thanks also for the economic incentives to misreport. I think tourism, that's definitely one thing, and we should probably be more specific that kind of these incentives in general, I think for economic reasons, to basically keep the economy going. We don't need to shut down. Extra strong if it's tourism related. That's something that we could draw on. That also indicates that there might be some controls that we could look at there to check that. So tourism flows the past year or something. I'll write down the tourism flows control. Thanks. Thank you for great questions and comments. I've taken lots of notes.